Well, hello, Dr. Winters. Thanks for sitting down and talking to me today. I'm really excited to get to meet with you. We're coming up on a year, my 1 year anniversary with Emergent, which has been great. We've added some great pieces, Mastering VT, and some other product additions that have been fantastic. And I really have enjoyed the learning and the product piece of Emergent, but I never really got to understand the consulting part. So I was hoping today we can have that conversation and you can help me understand and hopefully help the world understand as well. So my first question is, as a doctor, as a business owner, as a dad, I'm guessing you have just a few things on your to-do list. So why in the world would you want to be a consultant?
That's a really funny question because I remember when the idea first came to me, I said, that's not something I want to do. The other guys on the team were like, hey, we should, there's a lot of practices out there that seem like they need some help. We should do that. And I'm like, I don't want to be a consultant. That's not my thing. There's good people that are doing that all right. I don't need to be doing that. And I don't remember how we got involved the first time, but we did one consulting engagement and I got hooked really fast. Like I realized that I had kind of just something that really grabbed me. The fact that I could go in and kind of see what was going on in these individual doctors' lives and how much they were struggling with the business aspect of it. It was just really cool to be able to go in and to help them and to really feel like, okay, I'm actually helping vision therapy grow in a different way. Yes, my own practice, we were growing, but to be able to go in and then help other people grow their practices, I just felt like, wow, I could really be able to have an impact this way.
That's really cool. You mentioned personal life and goals, let me try that again. You mentioned personal life goals and how they impact business decisions. That's something that you've always emphasized to us is, personal life is important. Can you explain to me how you feel like that fits, why personal life and personal health and understanding where you are in space is impactful to business?
Yeah, I feel like that's where we always start with in our consulting. I do that for a reason. There are way too many practice owners that I know that get into it. They're seeing patients all day long. They go home, they kiss their kids goodnight, and then they're back on the computer for 4 or 5 hours trying to do all the business stuff on top of it. And then, rinse and repeat. Then it's just the same cycle the next day. And I've got 5 kids at home. And for me, having some systems and some structure in place, that was always really important to me. And so being able to help other doctors put some of those same systems in place to where they're not feeling like they have to work and burn the midnight oil or work on the weekends. That's actually why I think it's so important to understand what their life goals are, what is it that they're trying to accomplish or what they want. And almost always, rather than them talking about, hey, I want to get to this dollar amount, it's, I have this business so that I could spend more time with my family and to have more, time for life. And so that's actually a big part of what we do with a lot of our clients.
That's great. So without giving away any, recipe to the special sauce, can you give us an example of that? Like one suggestion you might make to a doctor who's overwhelmed or who's, spending 7 days a week working on their practice and maybe not as much time with their kids?
The first thing is just deciding that you're not going to do that anymore. That you're not going to work on the weekends and you're not going to work in the evenings, because as soon as you say that, then all of a sudden you've got to start to create systems and put things in place so that you're not doing that. Yeah. And I think that was one of the blessings I had from the beginning, is just to make that a decision. Well, I guess I didn't really make that decision. My wife made that decision. She said, you're not working in the evening.
You had no choice in the matter, right?
Exactly. And so it forced us to really think about how do we do things so that can be okay. One of the probably best compliments I ever had is as Emergent grew, I finally got to the point where I sold my practice. And I was talking to that doctor that I sold it to about a year later. And he said, I was always really worried about owning a practice because I had seen my friends that were working just nonstop on this business and having to deal with all these issues. And he said, you know, what's great is you already had so many systems in place. I just don't feel like that happens. Yeah, there's, you know, normal fires and things that have to be put out. But
Yeah.
for the most part, people just know what to do. They know the system and things just happen. And so, you know, that's systems are kind of my secret sauce. But as far as applying that broadly, when you start forcing yourself into, okay, I've got to be done by 5 o'clock so I can go spend time with my family. Okay, you know, X, Y, and Z that I was going to try to do at night, I can no longer do. So who's going to do that? And then how do I delegate that so that, you know, it's not just give it and forget. And then a few months later, it's like, wait, you're not doing that? Or, hey, this X, Y, Z is happening. Why is that not happening? So a lot of that is having systems so that it's not a delegate and forget, which is not really good delegation to begin with. It's, okay, how do we make this system so that I'm still involved, I'm still in charge, but other people are doing the work?
Right. Do you ever make the suggestion to a doctor that maybe we can reduce the number of tasks on the list for right now and just focus on the main concepts and then circle back to maybe the smaller details later?
Yeah, you know, that is sometimes what we do. But by and large, what I find is that doctors are trying to do things that are not doctor level activities to be doing. And
Yeah.
when I say doctor level, I also mean like CEO level activities as well for the business side,
Yeah.
right? They're to be able to have a good functioning practice, you need to be able to work on your practice. And you can't work on your practice if you're just in the nitty gritty of all the details of everything that's happening every day.
Yeah.
And so a lot of it is just stepping away and saying, okay, what are absolute necessary tasks that you have to do? What are those doctor level or CEO level tasks? And then what are the other tasks that we can then get to other people to do to help with that?
Yeah, you know, I've been in situations where the practice is very successful, and the more successful it gets, the more overwhelmed the doctor appears to be. That kind of sounds like exactly what you're talking about.
Yes.
Yeah.
Yeah. No, I see that all the time too. Yeah, the practice is growing, which is great, but that just means that the doctor then has more patients to deal with, more staff to deal with, more reports to deal with, and it becomes overwhelming to that person really quick unless they're starting to create systems to where other people are helping with those things.
Great. That's really cool. I wonder if we could look at the opposite side of that coin for a second. How about the practices that are stuck? They have good foundation, they have good framework, but they're just not moving forward. Talk about that for me.
Yeah, yeah, absolutely. You know, I've definitely had clients that way as well, where they're just like, you know, we've been doing this for 20 years and I mean it's okay, but we would just really like to see it bigger and better. And it's really interesting when I go into clinics that kind of have that issue. First, obviously, we want to talk about marketing. What are you doing? And a lot of times the thing is, well, not a lot. Like we do word of mouth. And so that's definitely part of that equation is, okay, let's make sure that we actually have solid marketing activities that we're doing consistently. That way that just constantly happens. A lot of people are stuck in that cycle where they'll get a bunch of patients, then they stop doing their marketing. So then the patients then decline. So then they start to do a little bit of marketing and then they get the patients and then they decline again. And that's why that we kind of get in that repetitive cycle and never see some real growth. And so it's one is getting that consistency of the marketing activities. And we have a lot of things that we do to help with that. But then the other part of that is that people don't realize that it's not always just about the marketing activities. They think that the reason that they need to grow is that more people need to know about them. But when we sit down and look at it, a lot of these clinics have a lot of people that are already good referrers, right? But maybe they're not doing so great at getting the patients that are coming in to actually sign up for vision therapy. And they won't know that unless they're keeping track of data. So that's also something that we come in and start right away. All right, we got to keep, we have to keep track of the key performance indicators. What are the absolute things that you need to know to see how well your practice is functioning? Because sometimes, as much as they think the growth or marketing is the thing that they have to do, it's really that we need to do a better job of getting the clients that are coming in and converting those to get into vision therapy.
Yeah, that's interesting. You know, I've been in practices that were small. I've been in practices that were large, practices that can afford a marketing person, and practices that cannot. And oftentimes finding the balance between patient care and marketing, especially for a smaller staff, is difficult because there's just not the manpower to go out and talk to people and meet people and send emails and send letters. Again, without giving away secret sauce, can you kind of speak to that a little bit, especially for maybe the smaller practices that only have 2, 3, maybe 4 staff members and want to market, but don't necessarily have the manpower for it?
Yeah. For instance, one of the things that's really good is having a really nice newsletter that goes out. And everyone says, I love, yeah, newsletter's a great idea. We should do that. And so they get one of those done and they realize how much time and effort that takes. And then it's like 2 years and they're like, we should do another newsletter. Well, one newsletter really doesn't do anything. It's that consistency, right? And so one of the things that also was a struggle for me in my practice until we hired a publicist. So one of the things that we've done is taken a lot of the clients, connected them with either my publicist or help them find somebody online. You can get people to help you do this kind of thing pretty inexpensively. And then you're not doing all the legwork. You're not doing all the work to write the stories and that kind of thing. Like the publicist that I use will call and interview the doctor, interview the new staff member that they're trying to put in the newsletter, or interview the success story patient. And so that's one of the ways that we'll help with that, to get that consistency.
In that same vein, I feel like hiring the right people is incredibly important. Sometimes staff turnover is an issue, sometimes not. How do you feel practices want to approach that? How do they find the right people, hire the right people, and keep the right people?
You can't have a discussion about practice management without talking about culture. And there's a reason for that. Culture really does matter, right? And understanding what makes your practice great, why people would want to stay with your practice, that actually takes some time and thought. That just doesn't happen, right? So we do spend a lot of time helping people cultivate and really understand what that culture is, and then helping do things that make people want to be at that practice other than just what they get paid, right? Vision therapists in particular, finding people that just absolutely love this. And we all know those vision therapists, yourself included, right? That just absolutely fall in love with this profession. And you got to make sure that on the flip side, not only do you have a great culture as far as patients are concerned, but as far as taking care of your staff too. So even if a vision therapist is really invested, you want to make sure that they're feeling like they're being supported by their boss, by the other employees. So understanding that's important. But finally, pay is important. There's a reason that people have to be paid to go to work. It's work, right? And people have to provide for their families. We ran into a situation where the person was complaining about turnover, and finally got, okay, what are you paying them? And I found out that they were paying like just super low rate. And it's like, well, of course you're having turnover because you're constantly, you're getting people that are just not in a situation where they're stable. So you're going to have turnover. So, right. But it's hard for just individual practitioners to know that kind of thing. Like, what do you pay someone? That's kind of another benefit of being someone that's been in a lot of practices, is we start to see, okay, what are the norms? And to be able to share those with people is super helpful too.
Do you feel like having someone to manage the business side of the practice is important if the practice can sustain it?
It's certainly helpful. Having someone or designated as the office manager is really good. I don't want people to feel like, to be successful though, as a practice owner, that you have to hire some, top line CEO type of individual or office manager. When you have that, you really want to create systems that aren't dependent on all-stars. Okay. Yeah. Every once in a while you have an all-star, but I've heard of plenty of practices that are like, we had this person in there and they grew the practice, but then that person left and then our vision therapy, program fell apart.
Yeah.
That's not great either, right? We want systems in place that are just good systems that work, as long as you have good people, not amazing people, but good people in place to be able to do good work.
Yeah, that's important. And people that care, I think, is a huge piece. And that's not something you can teach. That's something you have to just innately own and find when you hire people.
Finding good people. I see way too often people looking for people that have experience or that are really good at doing vision therapy. To a certain degree, yes, it's super helpful when you have someone that has experience coming in. But to me, what's more important is just what you just said, finding people that care, getting the qualities that are those intangibles that are really hard to hire or to teach someone. And so if you can find those really good people, then hopefully your system is really good as well, that you can just plug that person in, even if they don't know what even vision therapy is, right?
Oh, I read a book one time. I wish I could remember who wrote it, but the mantra in the book is hire the smile, train the skill, right?
Oh,
And
that's great.
that's really kind of what you're talking about. Something that kind of on a personal note that has always impressed me about Emergent and you and the rest of the Emergent staff is just the human connection. That seems to be incredibly important to you as a leader, incredibly important to the people that you hire. I'm flattered that you had me join Emergent because I feel like I'm good at that too, but it confirmed by the fact that we all work so well together. I'm guessing that's not just a business skill. That's something that you, I would assume, have at home, have it with your friends, have in other places of your life. Can you talk to me about the value of that piece, about the human connection, not just in practice, but in your friendships, in your family, and just in how that just permeates into everything that we're talking about?
That's a really great question, Robert, and something that's really easy to get sidetracked on. And I would be the first to admit that that's happened in my life, right? You start to get so, I just talked about how important data is. You start to focus on data, you start to focus on numbers, you start to focus on just the amount of stuff on your plate. And it's really easy sometimes to start forgetting about the humans, the people that you're working with, the people that you're doing this for, whether that's your family or the patients themselves and what their needs are. And so it's always good to take a step back and just remember why you are doing this. And I couldn't do this if I was just doing this for, I guess, just a regular old business that's making, XYZ cog. Like to me, let me say that again. I couldn't do this. What do they call that? Making widgets. There we go.
Good.
That brings up something else, which is I couldn't do this if this was just, consulting businesses that were out there making widgets. There is something about people that do vision therapy. Like, they're just a different breed. It's so refreshing. One of the first questions that we always ask is, why are you doing this? And I just don't get, well, I wanted to make a lot of money, or, I really just wanted something to make myself look good. Like,
Yeah.
and even if people don't really say that, it certainly could come off, but it never comes off that way when I'm talking with practice owners in this field. People are just inherently passionate and love what they do. They love the people that they're working with. And so I feel like that's kind of that's the main thing you got to have, is that passion to be a good business owner. The other stuff, yeah, let me help you put some systems in place. Let me allow those systems to get that passion back. It's okay if you lost it a little bit because you're just so overwhelmed.
Yeah.
But you got to have had that passion in the first place.
It's interesting that holistic approach really, again, I've been to I've worked in several different practices, and when things are not going well, we always remind ourselves, look at the kids who's getting better. Look at the traumatic brain injury patient who has their life back. I mean, that's the paycheck right there, right? I mean, we all have financial needs, as you stated, but really the fact that we have the ability to sit next to somebody for 16 weeks, 24 weeks and change their life. Like, how incredible is that? How many people can say those things? I mean, that's pretty cool. So one thing that's always impressed me about Emergent is just the need for connection, human connection. It seems to be a pillar in not only your business, but also in your personal life. Like, I really get that energy from you, that connection with people is first and foremost. Can you explain to me why you feel like that's so important for business? Why is it that Emergent needs to connect before necessarily trying to sell something, trying to sell a product, trying to sell services? Why is that so important to you? And how has that benefited Emergent, big scale?
My background is in business. I did my undergraduate in business and worked on a couple of businesses before I started down optometry, and particularly with consulting. I Probably the reason I was so hesitant to go into consulting is just, some of these consultants come in, they have their little, here's our little package, and it's kind of the same package that they just kind of resell over and over again. And it does feel very superficial sometimes. And I'm sure that they do great work and help people. But I think the reason that we've continued to do this is because I really do enjoy that connection that I make whenever I go in. And it's just, I feel almost honored that people will allow me to come in and go into their practices and to look at this stuff, which can be a little bit intimidating, having someone in looking at, hey, look at all this stuff that I know I'm not necessarily doing all that well. Like, that's kind of a vulnerable place to be. And so I feel actually really privileged to be able to come in. And to me, then it makes all the difference in the world when we're at OVDRA or other conferences and seeing these people that I've worked with come up and be able to give them a hug and ask how they're doing now. And that, I don't know, to me, that there's a lot of things I could have gone into, being with a business background, but I decided early on that, that connection was really important to me.
Yeah, that's really great. You know what I was thinking as you were answering that question was, really, you're doing vision therapy for business too, because you're taking the way they're doing it, you're making suggestions for change, you're asking them for suggestions on how they'd like to be different, and then you find an action plan to make it happen. And I think really, that's vision therapy, right? I mean, you've got it in several different directions. So.
That is so true. And there's been so many times I thought, this feels like I'm doing vision therapy. Yeah, there's a lot of parallels there.
Yeah, that's really great. Okay, so now I need to ask you the other side of the coin. Do you ever work with someone and they just call you after a month and say, Ben, this is not working. I need help. We need to figure something different out. Help. And because your initial suggestion maybe didn't hit right, didn't resonate, where do we go from there?
Yeah. That's another thing that's maybe different, is we don't just say, here you go, and then we'll see you later. Like, we continue to touch base, and that's a regular part of what we do, is that follow-up work. Because, any plan is not going to be perfect, right? There's going to be always issues. And so that's why it's really important that we have those key performance indicators that we're looking at, so that we can even highlight. So actually, more of the time is not them coming to me, it's me going to them and looking at their numbers and saying, I'm worried about this area here that we need to start tweaking or working on. But there certainly have been times when, things aren't going well and the client's panicking a bit. And that's actually been really rewarding too, is to kind of be there and say, I know it's feeling a little rough. And yes, let's make this adjustment and this adjustment, but let's also just kind of hold the course.
Yeah.
And that's been really beneficial to know, just again, having worked within my own businesses and my own practice and with other clients, that, hey, it's going to work out as long as we continue to do these things. And sure enough, it works out.
Yeah, that's great. So something that I'd like to ask you about is, when a doctor might think about owning a practice, because everybody that loves vision therapy doesn't want to be a practice owner. So do you think that there is a time, or is there a conversation that is there to be had about, joining a practice versus owning a practice versus, pausing to think about a different option?
Yeah, I think it's important for people to recognize that owning a practice isn't for everyone. And, that's maybe not something I would have said early in my career, because I was all about owning. But after doing this for a while, it's not easy.
Yeah.
And even with the systems that we put in place, um, there's just challenges and there's tough things that you have to do as a business owner. The rewards are amazing. And, would I have ever gone back and decided, yeah, I should have just worked as an employee my entire career? I'm definitely not that type of person. Like,
Yeah.
it's been rough in a lot of spots, but it's been incredibly rewarding. So I think that there are definitely some conversations that I've had with young docs or even older docs that are saying, I'm thinking about getting into vision therapy and owning my own practice. And I would just say, if you're in that situation and you're trying to decide if this is something that you want to do, I love having those conversations. And I don't charge for those types of conversations. Like, I'm super happy just to sit down and say, okay, well, have you considered this? Have you thought about that? Is this really something that you're ready to take on? And sometimes the answer is maybe not yet. Most of the time, though, it's yeah. As long as I have someone to help me. And that's where we're happy to be there too.
Yeah, very true. I have several friends in the business who have started out cold as a vision therapy practice, and the common theme always becomes, I had no idea how much work this was going to be. And I think that there's definitely value in you kind of laying the cards on the table before they make the decision to say, XYZ is going to be your workload, patient care, business, marketing, all those pieces, because you don't know what you don't know. And new practice owners don't know, not through any fault of their own. They just don't have the experience. Right. So that's so great that you do that. And at least, show them, give them a window into what it might look like and see if they're really up for it. Right. So.
No, absolutely. And actually those are the conversations I really love to have. I remember as a new practice, or when I was thinking about starting my own practice even, and just, my background was in business, and I still was like, hey, will someone just can I just come work for you for like a year? Yeah. And that's a tall order to ask someone to do. And I understand why no one really took me up on that. But yeah, to be able to give someone else kind of some insight, to be a mentor, that was so what I was looking for. So that's something I'm very, very happy to do for other people.
Yeah. You seem to have a teacher's heart, a teacher's spirit. Where does that come from?
I don't know. I think, I guess I'm naturally a empathetic person, maybe to a fault. And so I just remember what it was like being a new practice owner, and feeling a little overwhelmed, making a lot of, mistakes along the way. I would love to help people not make some of those mistakes. And I guess I'm also just really passionate about, bringing vision therapy to the world. And I know that the only way we can do that is to be better practice owners too.
Yeah. I really appreciate that about you. I really, I have always admired your willingness to step up and step out for people and say, here, I'm here to help, whether I'm making money doing it or not. Like, I'm here to help. And that's not something that everybody would do. So kudos to you for that,
Nice.
for being willing to do that. So just to kind of close this up, we've talked about a lot of different pieces, a lot of different angles, emergence consulting. I feel like I have a much better understanding of your perspective, of your approach, of the information that Emergent delivers. But if you could give one piece of advice to every doctor who's currently working in developmental optometry, just to help them, lead and grow and maybe even live a little bit better, what would that be?
It doesn't have to feel impossible.
Wow.
It doesn't. Like, I feel like, I guess that's maybe one of the reasons I felt so compelled after starting to do this to keep doing it, was just that I found people that were just overwhelmed and ready to be done with it. You
Yeah.
know, and that's kind of the worst case scenario for vision therapy. Like, we need people that want to do this. And I hate the thought that people would stop doing this because of the headache of trying to own a practice. And there's actual science to business.
Yeah.
And so, yeah, there's an art and science, but there's some science there on ways that you can do business that are not intuitive, that can really be helpful on for anyone that's feeling overwhelmed. And so, yeah, that really drives me to find people, to help people that are in that type of a situation, and just help them know that there's help out there.
That's great. Something interesting is that in our practice, we talk about money is a really bad reason for kids not to get help. And the idea being that, if a family can't afford it, we can find ways to help them. It's really a similar principle to what you're talking about, is that, the business side of it is not a good reason for doctors not to use their talent and use their skills to help people, and helping them kind of find that path and find that way is really powerful. And I want to really appreciate you for that, because not everybody does that. Not everybody says, hey, I have an idea, I know which way to go with this, I want to help you, just reach out your hand and I'm here. And so that's fantastic. And for you as a person, as a business owner, as Emergent, I mean, all those qualities shine through. So thank you for that. And I really appreciate that about you.
You just said something. So, just kind of last thought. The other thing I want to stop being said about vision therapy is, vision therapy is nice, but you just can't make any money at it. Which, I know we're not all about making money. That's obviously shouldn't be the driving force. But if people can keep saying that, that really does drive people away from wanting to do this field.
Yeah.
And it's just not true. It's flat out not true. In fact, we've proven over and over again with a lot of the clients, ones that have like a primary care office, this is the most profitable area of their practice. And so, yeah, if you're not feeling that way, just know that there are things that can be done to help it be that way.
Yeah, it's interesting. Whether you believe in prayer or karma or manifestation, like thinking about where you want it to go and having it land in a good space is the first step, right? Like they have to believe they can do it. So yeah, I like that a lot. So good deal. Okay, Dr. Winters, thank you very much for your insight and perspective. I really appreciate about you and about Emergent that, we never lose sight of the human connection, because that is so powerful and so important. Whether it's growth or clarity or stability or success, all of it stays possible because of the human connection. So I want to thank you. I really appreciate your time and your heart and your willingness to help. And I look forward to great things to come as part of Emergent.
Well, as always, thank you, Robert. Appreciate the time.
Yep. Thank you.